I have seen this time and time again on the guys who are on TRT and an aromatase inhibitor, and they are just not fully optimized. They come in, they're depressed, they have no libido, their joints are achy. Something that has come up a lot lately in the clinic is estradiol in men on testosterone replacement therapy. And there's a common fear around it that is completely unnecessary. It really stems from outdated protocols and super high doses of testosterone or anabolic steroids. So when testosterone replacement therapy is done correctly, we really do not need to worry about estradiol in men because it's a fear that doesn't need to be there. Recently, a patient came in because their primary care provider checked their estradiol and had a level of 60 and was telling them that's too high. And so, of course, they come to me with this fear that their estradiol is too high, and it's actually not. And this is the main reason I do not check an estradiol in men, because it places this unnecessary fear there and makes you think that you need to be on something that blocks your estrogen. And men need estradiol. In today's video, I'm going to explain all of that and the reasoning behind it. Estradiol has classically been labeled a female hormone, and I get it. It is well known as one of the female hormones, but men also have estradiol, and they actually need it. This fear that estradiol is going to feminize you is a poor way of looking at it. And it's just a matter of just not knowing what all estradiol actually does for men. That's what we're going to kind of break down today and kind of stop this fear-based medicine, outdated protocols. So when you are on testosterone replacement therapy, there is this enzyme called aromatase. It essentially kind of gobbles up that testosterone and spits out estradiol and dihydrotestosterone, DHT. And those are what's called metabolites. So when we block those metabolites, we're essentially blocking half of the benefits of testosterone. And ultimately, I see this all the time. Guys that come in who were seeing a previous testosterone replacement provider and they're on an aromatase inhibitor and they feel not necessarily awful, but they're not optimized. And it's like, well, what's all this talk about testosterone replacement therapy and its benefits? And I'm not seeing that. It's because they're on that aromatase inhibitor. So let's talk about all the benefits of estradiol for men. So brain, it's what's considered neuroprotective. So it helps reduce these beta amyloid plaques, which are responsible for disease processes like Alzheimer's. So it's neuroprotective. You need it for your bones. So for those strong, healthy bones, you need estradiol. And then libido is another really big one. So I see this all the time when estrogen is blocked in men. And one of their major complaints when they come to me is like, well, I'm on testosterone replacement therapy, but I'm feeling good in, several areas, but my libido still sucks. Isn't that what testosterone is supposed to help? And which, yes, it is, but it's not all that it does. And what I most commonly see is a low libido when we're blocking that estrogen. Estradiol is very important for a healthy sex drive. Estradiol is needed for just overall body composition, metabolism. So it will help your body respond to insulin better. So improving that insulin sensitivity. It helps reduce that fat in the midsection that can be really hard to get rid of. So these are just a few of the many reasons why we don't want to block estradiol in men. Honestly, I couldn't even tell you what a normal range is, because what I find is that when an estradiol is checked, it's not correlating with any symptoms that the patient is experiencing. So even more importantly, if we're completely asymptomatic, meaning we don't have any of that gynecomastia or that male breast tissue, water retention, mood issues, we have absolutely no reason to be checking an estradiol, because I've seen levels upwards of greater than 100 and the man be completely asymptomatic. And that is normal. Like, we can leave that there. We don't need to block it. If we're completely asymptomatic, we don't need to go digging for something. Providers and definitely patients will see levels of 50 or 60 and start to freak out because that lab reference panel will consider that elevated for a man. If it's not correlating with any kind of symptoms, then we're digging for something. It's like we're fishing for a problem that's not there, if that makes sense. So the patient I was talking about earlier who had an estradiol level checked, and I think it was 60, and was concerned about it. He is completely asymptomatic. There is no male breast tissue. There's no nipple sensitivity. There's no water retention. He's feeling great on his therapy. No side effects whatsoever. Estradiol did not need to be checked. And it was reading high in terms of like what the reference on that lab panel says. And so even though I go through all of this education to begin with, it can still create this fear when you see this number listed. But this is why it's so important to know why you're doing X, Y, and Z, or even bigger than that, treating the patient and not the number, which is what I do. And I use labs as a tool, as a guideline. And in that tool belt, if I don't need to be checking an estradiol because we're just wasting resources and money in getting this lab result for what? Especially when the person's asymptomatic. That's why it's so important to treat the patient and not the number. An aromatase inhibitor is a medicine that blocks that conversion of testosterone to estrogen. It was originally developed as a breast cancer treatment because it blocks estrogen and is still used for that. The use of it with testosterone replacement therapy stems back to the bodybuilding era in like the 60s, 70s, maybe a little bit earlier, but bodybuilding was very popular, but also the rise of steroids and how available they were. And estradiol itself does make you hold on to water, which is not a bad thing, but a lot of these bodybuilders, one, were on anabolic steroids or doses that were just way too high. They were wanting to block that estrogen completely so that they could almost like dehydrate themselves. They didn't want that extra water bloating kind of thing. And I can tell you right now that if testosterone replacement therapy is dosed appropriately with dose and frequency, none of this once a week, or definitely not once every 2 weeks, we don't see these negative side effects. We just don't see it. That's where this all kind of stems from, is because we know how testosterone works. We know it metabolizes. We know that it metabolizes into estradiol, and it's always just been thought estrogen bad in men, but it's not. With that way of thinking, it's like, okay, well, let's block estrogen, put you on an aromatase inhibitor. And honestly, it became like a standard protocol, but it shouldn't be. But it is. It's still used today. I get guys all the time from other clinics on TRT and an aromatase inhibitor, and I've took every single one of them off of it, and they're doing great. When estradiol gets too low, and I have seen this time and time again on the guys who are on TRT and an aromatase inhibitor, and they are just not fully optimized. They come in, they're depressed, they have no libido, their joints are achy. And again, back to the water retention, when we block estrogen and we're not holding on to that water in our joints and providing that lubrication, you'll get those achy joints. They'll have that brain fog. And honestly, I've had a couple who felt worse than before they were on testosterone replacement therapy. That's kind of what a crashed estradiol looks like. And it's miserable. I think that testosterone replacement therapy is mismanaged just in general from a lack of knowledge around it and these outdated protocols. Personally, in nurse practitioner school, got zero education on hormone replacement therapy and testosterone. And so I had to seek this information out, take courses, and really put in the time to become a master in hormone replacement therapy. I don't think that providers who see a estradiol and think it's high or dose testosterone once a week are doing this to be malicious. I just think that the appropriate treatment has not been pushed out into the healthcare world. It's very unfortunate. I think they're working with what they have, and it's just not enough to manage TRT well. If you're on testosterone replacement therapy and concerned about your estradiol, I would want you to first just check in with yourself and your symptoms. How do you feel? If your libido is good, your energy is good, your joints feel good, you're moving around well, then don't be fishing for a problem that's not there. Think about how you feel overall, because that is what is important. The main thing I would want you to get value out of this video is just knowing that estradiol is not the villain, and you do not need to be blocking it on testosterone replacement therapy. And if you're looking for a provider who specializes in TRT, then you can give us a call here at Pure Balance.